Welcome to the Chairman's Perspective Podcast.
Hi, I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and today we have a very important topic, a very, very critical topic in our Shelby County community right now. We're going to talk mental health and coping during the COVID-19 crisis here in Shelby County and honestly throughout the world right now. Today I'm very happy to have Dr. Althea Stewart on the show. She's the Senior Associate Dean for Community Health Engagement at UT Health Science Center. We'll be right back on the Chairman's Perspective.
Jazz, America's own original musical art form. When did it start? Who were and are some of the major players? How do you distinguish what kind of jazz you're listening to? We talk about the great and lesser-known artists, songs and tunes, the instruments, and the social impact jazz has had on world culture since its beginning at the start of the 20th century.
Riffin' on Jazz on the KUDZUKIAN Network. KUDZUKIAN!
And we're back on the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and today we have a very important topic. This is part one, called Mental Health and Coping During COVID-19. I've got a dear friend with me who's just a national and international leader, but also a native of Memphis. We've got the former president of the American Psychiatric Association, who is also the current Senior Associate Dean for the Center for Community Health Engagement at the University of Tennessee Health Science Center, Dr. Althea Stewart. Thank you so much for being here, especially I know how busy you are, especially in the midst of the coronavirus and everything UT Health Science Center is doing to partner with the community. We're going to get right to it. Dr. Stewart, reason I wanted to do this show was to talk about stress and coping. The outbreak of the coronavirus, COVID-19, has caused a lot of stress for people in Memphis and Shelby County and across the country. Fear and anxiety, it seems to be overwhelming many people, and so thank you for being here. Can we get right to it to talk about what you think we need to do to help our citizens and listeners to cope during this really important time?
Well, thank you, Mr. Chairman, for having this conversation. First of all, it is a very important conversation, and now that I think we have done a very good job of educating our community about the physical and medical aspects of this, I think it is a perfect time for us to start thinking about the psychological impact of the crisis that we're experiencing, and also a couple of other areas that I want to touch on just briefly. People who have mental illness who are also a part of the population going through this crisis, and especially children. Wow. Who are in a very unique situation in our communities. I think to start, I think we have to have this conversation because it is so important to the other conversation that you're going to have about medical aspects and healthcare and all of those things and stopping the spread of the virus. If you think about it from a public health standpoint, what we are being encouraged to do by the CDC, the World Health Organization, and our very own health department is to work together to stop the spread. That's why schools have closed. That's why group gatherings have been reduced. That's why churches are being asked not to meet. Those are all things that we hope will help to stop the spread of it. That's a public health approach. It's a well-known, well-tested, tried and true approach. And we hope that it will be successful in our area to reduce the number of people who actually contract the virus. But in the meantime, we've got all of the panic that surrounds, do I have it, don't I have it? Can I get tested? Can I get tested? If I get tested, what does that mean? Do I self-isolate or quarantine? If I'm working from home, I'm now home. I have still my job responsibilities. Right. If I have kids, my kids are out of school. This is an unnatural situation for many citizens here in the Memphis community. And I think it warrants a little bit of understanding of what we are dealing with. Right. And how we might best deal with it. First, let's start with the people who are working from home. Everyone envisions working from home as being a wonderful thing. It is actually very stressful. You have your regular work responsibilities, and even though you're doing it in the comfort of your own home,
right.
Most people who work from home are on conference calls. They're now learning to use Zoom, as I am, and
Right.
maybe you are,
I am too.
or Skype or FaceTime or something to maintain contact with the people they need to be in contact with. They have to be very prepared, and while it may sound like fun to be able to do it in your pajamas, that's really not the business approach that most employers are looking for. So there's still a lot of preparation
Sure.
that goes into being ready to demonstrate that you're doing your job. And then if you have children in the house, there's the whole point of mom or dad are working. This is not
That's
day
exactly
off
right.
time. And so helping everyone understand the rules of the house, as it were, that when I'm doing my meetings or calls or other things, you can't just burst into the room and start screaming at me, I want this or that.
Right.
And I may not be always able to immediately respond to a request. There are all kinds of new things that families are having to understand and navigate that we hadn't planned on doing right now. And then there are the parents who aren't able to work from home, who have to go to work, and who never had to think about regular daycare for their kids. If you've got a child under the age of 18 and you don't have a safe place for them to be or someone to be with them, you have a problem.
Right.
Because you've got to be at work. And while I know that many employers are working very hard to set up daycare for their employees, I know in the healthcare field and first responders, that's the place where most people are focusing their attention, understandably so. But there are other people out there who have the same challenges, who have to report to their jobs, whatever it is, every day. They are cleaning, they're disinfecting,
Right.
they're the support staff that have to be there to answer the phones directly. There are all kinds of jobs in that category where you don't have a lot of leeway, and that's stressful. If you've got a child who's medically ill and is in the hospital, if you've got a child who's right now in juvenile court or in juvenile detention, those are the situations where if we don't take some time to think about it, those parents are going to be significantly stressed because now they've got to worry about the house and the child who's out of the house.
Wow.
There are all of these things that we think of as part of the continuum within the mental health arena that people like me are thinking about and trying to figure out what to do about. For people who are mentally ill and who are in some kind of treatment, it may be that your clinic is not open. And you may need to communicate with someone by phone or through one of the virtual platforms. But that takes some planning, and not everyone has access to a laptop or a desktop at home or where they live.
That's
and many
right.
people with mental illness may not have an independent living situation. They may be with family or in a residential facility or other things. There are so many pieces to this that impact our mental health and well-being that we're just now starting to grapple with and get a handle on. I think our system is ready to do it. As I've talked with the various mental health providers in our community, they understand they will stay open. They understand that people will continue to need this help, and most of them are making provisions as best they can to protect their own staff, but also to continue to be able to serve the community.
Really good. You're listening to the Chairman's Perspective. We're with Dr. Altha Stewart. We're talking today about mental health and coping during COVID-19. We're going to be right back. In just a minute, I want to talk about how we identify those stressors and some of the things all of us are experiencing. But we're going to be right back on the Chairman's Perspective on the KUDZUKIAN Network.
The Chairman's Perspective on the KUDZUKIAN Network.
I'm Cynthia Daniels, host of Grind Set. Are you looking to start a business? Do you need tips on how to scale up? Get it on Grind Set. On this show, our guests will keep you listening. What's your Grind Set? If you happen to miss some of our episodes, make sure you check us out on Spotify, Apple Podcasts, TuneIn, Stitcher, or your favorite podcast provider.
Grind Set on the KUDZUKIAN Network. KUDZUKIAN.
And we're back on the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners. I'm really delighted today to be with Dr. Altha Stewart. She's Senior Associate Dean for Community Health Engagement at UT Health Science Center. She's also the past President of the American Psychiatric Association. Dr. Stewart, again, thank you for being on this really important show as we talk about mental health and coping during COVID-19. I'm just going to share some, or at least one of the things I've experienced lately. And again, I'm juggling work, my full-time job. I work at a local university at Christian Brothers University, and then I'm also a public servant. I've noticed over the last 2-3 weeks and dealing just with different issues around the coronavirus, I'm having a little trouble sleeping. Even when I'm at home, I'm having a hard time really relaxing. Sometimes stress goes in my shoulders. I know stress goes in different places. But I've also talked to other friends and colleagues, and they've mentioned a couple things to me. Fear and worry about their own health and the fear of their loved ones, especially people I know who have a senior citizen who might be in a nursing facility. A lot of friends have told me that they've had changes in their sleep and eating patterns. They've got chronic conditions already. They've got diabetes. They've had high blood pressure. They're seeing those things, probably because of stress, getting worse. And then also, I think there's been reports in the media about an increase of individuals using alcohol, tobacco, and drugs to deal with the stress of this infectious disease, the coronavirus. Are those normal symptoms that we hear about, and how do you address those symptoms of sleeplessness and change in eating patterns and literally worrying yourself sick about your grandmother or your daughter who you might not be able to be close to?
These are really typical responses to the fear of the unknown. Okay. When we either get no information, bad information, or inadequate information, our mind goes to the worst possible scenario 99.9% of the time. Okay. It's just human that we see the worst when we don't have enough information to make good decisions. A part of what you described is a very normal response to the reality that this is a bad virus. Wow. It is not something to play with, as my mother used to say. Okay. And that people should take seriously all of the recommendations from the health officials, from the CDC, from the World Health Organization, and our very own health department here in Shelby County have been absolutely spectacular with getting the information about what we all need to do to stop the spread. Clearly, washing your hands, something we should all have been doing anyway. Right. If you don't know how to properly wash your hands, learn how to properly wash your hands. The 20-second rule involves scrubbing, not just wiping and rinsing. It actually is scrubbing the hands and the back and the front and in between the fingers and under the fingernails. Anywhere this little virus could hide and wait to descend on a surface and capture you in another way. Hand sanitizer, all of those things that we've been encouraged to do, people must take that seriously. The social distancing, I think, is the hardest one for people to understand, because if they say you can be in small groups of 10, well, why can't I be in small groups of 10 with people if I know them and I'm pretty sure they're not sick? There are reasons for all of these rules that have to do with the science of the virus that is killing people. And I can't say it any more simply than that. We actually have a conference room that's been marked off with 6 feet between the chairs with a piece of paper that says you can sit here and the next one you sit there. Wow. So that if we are meeting face to face, we are spread out so that there's no temptation to get close to someone when you really shouldn't. We don't know what that period of incubation, when people don't show symptoms but are positive for the virus, we don't know what all goes on in the individual's body, or as they're transmitting that to someone else, what all of that means. All we know is that if you are positive and you begin to show symptoms, you need to immediately remove yourself from other people.
As we talk more about stress, Dr. Stewart, I know we all want current information. The Shelby County Health Department, Dr. Lisa Haushalter, does a daily update. I think the local media has done a very good job getting the word out about the spread and what we can do to prevent things. But at the same time, can we watch too much TV? Can we see too many shows on Facebook? Because at times when I'm watching CNN or some other news broadcast, breaking news every 30 seconds, and it's not good news. Should we take a pause during the day from the media? I think for our own mental health and well-being, we ought to get out of the 24-hour news cycle. We ought to stop watching constantly every channel and clicking to another channel when that one goes to a commercial to see if we're missing anything. I think that is impacting us negatively. And once or twice a day, or pick a channel, and if they're not showing it, don't go searching for it, and find other ways. Read a book, play a game, take a walk. People are thinking they can't go outside when they're quarantined or self-isolating, but the reality is going outside, as long as you maintain social distance, is probably not bad for you. Right. I saw clips yesterday of a family that took a walk and they played board games in the back of their SUV just to be in a different environment, to give the kids a different sense. And it was just that family. They didn't invite other people. They stayed away from folks on the walking trail. So there are ways that we can creatively comply with the health rules that we need to, and change our behaviors the way that we need to, without making life dull and filled with 24-hour news. So reading a book, you suggested reading the book. Those things that are paper that you open and close? Yeah, that we used to, I think I've seen one of those at some point. But doing activities that we enjoy, taking the walk around the block, I assume is still good. You know, a lot of people talk about mindfulness and stretching and breathing exercises. A lot of those type of things, aren't they available online and free? There are apps for just about each of those things. You can search for them online and find a multitude of ways to practice that meet your need, your physical capability, your mindset, as it were, and belief in those things. I think the other thing that is contributing a lot to the stress that people are experiencing is this, if you have a compromised health condition, or if you have family who have those things, just what you can and cannot do. And I think the health department has been very clear that we should minimize contact in those areas, but it doesn't mean that you can't take food to grandma. It just means that you can't be closer than 6 feet. Right. And if you have signs and symptoms, you shouldn't go at all. There are within the accountability measures that we're now finding as our new normal, there are ways that we can still remain social. Because the one thing we don't want to see happen is that social isolation turns into people being so afraid to be around others that they're by themselves, and that has a whole other level of mental health issue associated with it. Very good. We're going to put a pin in that. We're going to be back on the Chairman's Perspective on the KUDZUKIAN Network.
The Chairman's Perspective on the KUDZUKIAN Network. R&R on Sports.
Pitcher, left-hander, Vita Blue. Welcome to R&R on Sports.
Thank you very much. I'm glad to be on. Let's get it on, man. Let's talk to baseball. That's right. Talk to sports.
It's R&R on Sports.
We're back on the Chairman's Perspective. I'm Mark Billingsley, Shelby County Board of Commissioners Chairman, and I'm with, again, my good friend, Dr. Altha Stewart. She's Senior Associate Dean for Community Health Engagement at the University of Tennessee Health Science Center. She's also the former president of the American Psychiatric Association. A pleasure to be here. Today we're talking about mental health and coping during COVID-19. Dr. Stewart, I'm a parent of 2 teenagers. Like many parents, this has been disruptive for me as a parent. It's been disruptive to my children. You know, they're used to going to school every day. They tend to be early risers. They get to school, then they have all their activities, and then typically they're home about 6 o'clock. So they spend their entire day at school in some way, shape, or form. For parents that are dealing with a house full of children at this point, or no one's at home because mom and dad do still have to go to work. I've seen some stressors, and I've heard some things from parents where their kids are doing some excessive worrying. They're talking about their child has sadness. Some of the things we talked about in the last segment, their children are having trouble sleeping, they're irritable, some of them are acting out. Even though some of them have an opportunity to school online, they seem to be blowing off school right now because they're not sure about the future. And again, I hate to bring up alcohol and tobacco and other drug uses, but again, we have some teenagers that struggle with those factors. So for parents that are listening, Dr. Stewart, what is your advice for the parents and these children who now don't have a schedule Monday through Friday?
I think the most important thing right now is, and perhaps more importantly than ever before, is we have to talk to the children about this. We have to have conversations. It's going to be tough. Parents don't have all the information they need about the virus and the spread, and the misconception that young kids or young adults aren't going to get it, so you don't have to worry about them. I think we've just got to start. We have to initiate that conversation and start with, I know it must be frightening, all that's going on. That opens the door to making it not you're a fraidy cat or you got to buck up and everything's going to be okay. What we don't want to do is...
Can you repeat that just one more time? Because I think it's sometimes so hard as a parent
to know where to start.
You know, because again, I love my kids and I think they love me and my wife. But you know, they're teenagers and they're not necessarily used to talking to us as much unless they're in trouble or they got a special request. So how do you, again, will you repeat how you have that conversation?
You can use a variation on, I know it must be frightening all that's going on right now. Or if you've got to be feeling something about all of the news that we're getting, or if I were you, I know I'd be really concerned with everything I'm hearing and all this information 24 hours a day. Some variation on that as to in interacting with the young person in a way that allows them to not feel like, oh, here we go, another conversation.
Exactly.
That is more, you know, this is a difficult time. I'm having trouble. You know,
so acknowledging that even you as a parent, you're struggling with it. Be honest
about it. That I know you must be, I know I am, and if we're both struggling with this, we need to talk, you know, and understanding that even if you try not to be honest, even if you try to minimize the severity of what's going on around them, kids pick up on our concerns real easily, and you can say, no, everything's okay, we're fine, don't worry about it. And they'll sense in your body language, in your tone, in your eye contact, that that's not true. And that doesn't help, because if we have to have more significant, tougher conversations at some point, maybe grandma or grandpa, you know, has tested positive, or a good friend of theirs, or someone in my office, and does that open the door to maybe before we all came home to work that I may have been exposed? You don't want to start this conversation off with dishonesty. It will come back to bite us, I think, if we do. We have to reassure them that everything is being done that we know to do to minimize the effect on us. We're following the orders of the doctors. We're doing what the health department says. We're minimizing our contacts so that we don't inadvertently do something. We're learning that the things we were always taught to do, wash your hands, clean your area, you know, take off your shoes when you walk in the house so you don't track things in. All of those things now are really important, and you can make that a part of the conversation. This is why we're going to practice. All of us are going to practice. You know, have a little competition. If I fail to do it, you get to call me on it, and that could be $1 in your you know, dollar box, or you know, whatever works for your family. Customize it. This one you can be really creative with this stuff.
Let me ask you this, Dr. Stewart. I'm blessed. My wife is at home. She's a homemaker. She's there right now with my two teenagers. I've got a son and a daughter. I'm blessed that I have that opportunity. The super majority of people in this community don't have anyone at home. So what's your counsel for those parents that still have to go to work? They might be a policeman, a fireman, they might be a healthcare worker. They have to go to the hospital and they have to work. They go to the fire station. What's your advice to those parents as well as the kids that are at home alone?
The first thing is, if you're employed and you're considered an essential worker, ask your employer, what provisions are going to be made since my kids are out of school and I have to be here? Are you able to do anything? Can I count on you for something? Would you allow me to go and search for other places and come back and still have a job? We know, for example, locally, I believe the Y is starting to work on a program to do some of that for parents who have no other options. This is when neighbors can be really helpful, because if you know them and they are sure and safe, At the very least, a child under 18 cannot stay at home alone. Otherwise, the parent is in jeopardy of being accused of abandonment, and then we know what happens. So you have to find trusted people for whom you believe it is safe. And if that means maybe it's time for neighborhoods to come up with some shared arrangement.
It's a great idea.
Or family members to coordinate, as long as it's not above the limit that we're asked to remain under for people gathering, and as long as we maintain the principles of social distance, this is the time when creativity and collective participation in neighborhoods could become very helpful. I mean, in the old days, you'd have someone come to the house and take care of your kids.
We've only got about 30 seconds left, Dr. Stewart. For individuals who want more information, I'm going to encourage them to go to our Shelby County government website, as well as the Shelby County Health Department website. Any resources that you might want to offer up?
We have the center at the University of Tennessee where we have some of this information, and we can certainly provide resources. If people want to call us at 901-448-4200.
Will you repeat that one more time?
901-448-4200. We will provide whatever resources we have and know about.
Very good. It's been a pleasure today to have Dr. Altha Stewart with us. We've been talking about mental health and coping during COVID-19. This was part 1, but we're going to have a part 2 show, so tune in to the KUDZUKIAN Network, and we'll be back with more information.
Are you telling me that Jesse Jackson couldn't brush his shoulders off?
Welcome to Funky Politics, Brother Cornell Belcher. How are you, sir?
I'm honored to be a part of Funky Politics. America's not going to fail because of some outside army invades us. No, America's going to fail because of Americans can't get along.
Now is not the time to hate or criticize. Now is the time to disinfect and deodorize. Light the incense. It's going to be funky because this is one funky show.
Funky Politics.
I want to thank everybody for tuning in today to the Chairman's Perspective on the KUDZUKIAN Network. Today is a trying time for all of us, not only in Memphis and Shelby County, but across the country as we deal with the effects of COVID-19. I want to thank Dr. Altha Stewart with the University of Tennessee Health Science Center, who's joined us today for part 1 on mental health and coping during COVID-19. I want to thank all Shelby County employees, our policemen, our firefighters, our healthcare staff that are dealing each and every day with this crisis. I want to encourage you to continue to wash your hands vigorously, pay attention to what's being put out by our health department and to the Centers for Disease Control. Again, I wish you a very happy and healthy week, and we'll be back on the KUDZUKIAN Network.
The Chairman's Perspective Podcast. Executive producer, Shelby County Commission's Chairman, Mark Billingsley. Directed, produced, recorded, and distributed by KUDZUKIAN.